Okay. I'm Danielle, and I'm here with
Lauren.
And can you tell me what you do?
I'm a registered respiratory therapist.
And we both work at Riverview Medical Center. I'm just going to ask her a series of questions. So can you tell me what is the respiratory therapy?
Sure, it's a subspecialty that focuses on the cardiopulmonary system.
Okay. And how would I get into the field, and what degree would I need?
So you can get in the field pretty easily. You would need a 2-year degree. Right now, Brookdale offers the class. Our profession is looking for a 4-year degree. So schools like Rowan are offering 4-year degrees, and those are called like advanced profession respiratory therapists.
Awesome. And then who as a patient receives respiratory therapy?
So we are very, just like nurses have patients at every level. We have from neonates until geriatrics, and anyone can receive respiratory therapy.
Okay, and when is it necessary?
Well, going back to the previous question, you can have a baby that's being born, a 24-week baby that would need respiratory therapy, or it can be just like a newborn, and might need a breathing treatment, or they might need to be intubated. It can be an adult that needs a breathing treatment or intubation, or they might just be born with cystic fibrosis and need to have that kind of therapy for the rest of their life. It's a very broad range of therapy. We're talking a car accident, and they need to have something. They might need to be intubated. They might need a BiPAP. It really depends.
A lot. How much money can be made in that career?
Salary ranges, but I would say in New Jersey, post-COVID, high 70s, low 80s.
Do you know what they start at here by chance? Like, just for an example.
Yeah, here, low 80s.
Not bad.
Mm-hmm.
And then what kind of work setting can you have? Like, where can you work?
You can work bedside in the hospital. You can also work at like a long-term vent unit. You can work in cardiac rehab, pulmonary rehab. You can work at home care, like DMEs, where you go to people's homes and help them with their home equipment. Those are the types of settings.
Would you ever do something like that? Like work in a different setting?
I don't know if I would ever go into a home setting. I don't know. I don't think I would. Some people, I don't know, might live in dangerous neighborhoods or might not have their home like in the safest
That's a lot to
conditions.
think about.
Yeah.
I wouldn't have even thought about something
I'm not
like
sure
that.
if I would
Feel comfortable. Yeah. And then what do your shifts look like while working? So like what's your time management like?
So usually the hospital shifts, there are 3 shifts of either 12 hours, 7 p.m. to 7 a.m. or 7 a.m. to 7 p.m. This hospital does it a little different. They have swing shifts of like 3 p.m. to 11 p.m. I used to work at Jersey Shore, and they never had shifts like that. I also work per diem at Monmouth. Sometimes we'll do 7 a.m. to 3 p.m., but mostly they're 12-hour shifts.
So like what does it look like when you come into work? Like what's the first thing you have to do? And like walk me through a shift with you.
So we usually take report from our from the night shift, and then I will go through my patient list, check their chart out, see if there's anything significant that I need to be aware of, and then I will go to the unit and pull meds, and I need to evaluate the patient, give them their medications, and make sure that everything is okay with them.
Okay. How has the role of respiratory therapists evolved in the past decade, particularly with COVID and advancements in technology?
Well, I've been a therapist for almost 4 years, and so I can't really speak the last decade. There has been obviously newer equipment, but since COVID, I found that the acuity in the hospitals has been increased. Personally, I don't know. I can't really speak if there hasn't been studies, but I in the hospital it's definitely been busier, a lot busier than it was before. Firsthand, that's what I've seen.
Did you work through COVID at all, or like not really?
Yes.
What was that like? Crazy.
Hard. And I worked at Jersey Shore through it. So we
It's a big
had
hospital.
the hardest of the hard patients. We proned there, to where we flipped the patients onto their bellies while they were vented, and it was very hard. And we had ECMO. With the heart and lung machine, where it took the blood out of the body and oxygenated it and then put it back in, and it was very, very hard work, and most of the patients didn't make it.
Oh my god.
Yeah, so it was a lot of hard work, and it was very sad.
That's heavy.
Yeah,
That's
yeah.
really heavy.
Mhm.
Explain how you assess and treat patients in critical care conditions and situations like during a code or respiratory failure.
Well, during code, the first thing that we need to do is just to maintain their airway. When we go to a code, the only thing that we're worrying about, we just get to the head of the bed and we're bagging. We're not involved in any of the compressions. We're not involved in any of that. Here at this hospital, respiratory therapists are allowed to intubate if they're certified. I'm not certified here. I think I need just to do a class or something. But where I used to work, we had CRNAs come and intubate. So once you get an airway intact, then that's when you bag easier. You have the 1-to-1, one breath every 5 seconds instead of the 30 and 2 for the ACLS guidelines for that. But that's our main goal.
You're good.
Our main job in the codes. As far as like in a rapid, we always go in, ask the nurse what the reason for the code is. The code rapid is. If it's respiratory, we see what they're on. We'll listen to them. We'll see what their pulse ox is, and we'll try and find out a little bit of background and see what's going on, and then see if we can help in any way to before the doctor comes. But there have been many times, I haven't been to any rapids in this hospital yet, where I have been able to, clear the rapid before the doctors even got there, because it was something like the oxygen was off, or the patient just needed to be suctioned, or things like that that were easily, made better by, it was just a simple respiratory device kind of thing.
Gotcha. And then, how do you cope with emotional challenges of working with critically ill patients, like especially those who might not make it?
It is very tough, and that's something I think you're gonna find with nursing too, that not everyone does make it, and you do get attached to a lot of these patients, and not everyone does make it, and you have to. I always find it. I always put it this way, like, just like you're there for the babies when they take their first breath, that you're always there, like you're there also for the older people, like when they're there to take their last breath too. It's like an honor either way, and it's it's unfortunate, but there comes a time, like, everyone is born and everyone dies too, and you just have to do the best that you can and just hope that you do a good job.
Yeah, you're really like impacting these people's lives. Have you ever faced ethical dilemmas, like, for an example, a conflict in value?
Yes, many times.
How do you work through that?
There's times when ethics committees have had to get involved in some cases, and it would come down to the ethics committee to where they would have to make up the decision, and you really don't have a say, and sometimes you agree with it, sometimes you don't agree with it, and you don't really have a say with it. A lot of the times, down by where I used to work, there was religious communities, and they like to do one thing with their family members, and what the outcome is going to be ultimately, and you don't really agree with it, but it's what they believe in and what they want to do is right, so you can't really say anything or do anything. It's just, you have to respect it. You just have to do it, and that's what healthcare is too. You're just going to come across that a lot, and with nursing too, you're going to come across it.
Yeah. And then what qualities do you think a successful respiratory therapist needs?
I think the first and foremost quality, time management, and you have to have a very good time management skills. You have to be compassionate and caring, and and you have to get along well with everyone else, like other disciplines. That's very important too, to be able to have good communication skills between other disciplines, and then also with patients and their families as well.
Okay, and then my last question is, what has been your most significant professional achievement?
It's hard, because you can't just have one professional achievement. I guess just getting my license and just working in the field, and just you can't just have one. It's hard to say so, because really professionally, you can't really. You're not you're just a respiratory therapist, but you're a therapist, and you're there to do your job. And I guess it feels really good, when you have a patient that's come so far and has really gotten off a ventilator and has been able to be discharged and go home. That's really a sense of achievement, but it's not really professional. It's a personal kind of achievement.
Yeah.
But, yeah.
That makes sense. Well, thank you so much for letting me
Oh,
interview
you're
you.
welcome.
Okay.